Hey everyone, welcome to the Happy Flosser podcast. My name is Billy Lunt. I am your host, and I'm here to talk to you about all things dental hygiene to support you on your journey through the dental hygiene program. It's really great to be with you today. And today's topic may not apply to everyone. It really just depends on where you live. But I wanted to cover nitrous oxide sedation, also known as laughing gas. Not everyone has the certification in their state, and not everyone has that in their curriculum as a dental hygiene student. But those students that do have it in their curriculum have asked to have an episode published that just kind of covers some of the basics of nitrous oxide. So that's what I'm here to do for you guys. You reach out, you ask, and here it is. So nitrous oxide, it's an inhalation sedation used in dentistry, and it's a mixture of nitrous and oxygen. And the way that it's administered is through a nose piece or a mask. So think about the fact that you can't really administer it through the mouth because we need to be able to access the mouth. So oftentimes patients who need nitrous oxide sedation, it works out really well to have a nose piece so that we're able to still access the oral cavity. So it works out really well. Nitrous oxide. The exact mechanism of nitrous oxide is unknown, but it acts as a central nervous system depressant. And it works great for reducing anxiety or agitation, without the use of sedative drugs. So minimal sedation provides a minimally depressive level of consciousness, right? And the patient is still able to independently and consciously maintain an airway, respond to you. If you're asking them to turn towards you, turn away. They can respond to tactile stimulation and verbal commands like bite down if you're going to check their bite, or any kind of other verbal command. So it works out really well because the patient is able to still be interactive when you're providing care to them. When you think about a moderate sedation level for a patient, that's a little more invasive, right? So the patient responds purposefully to verbal commands, either alone or accompanied by some light tactile stimulation. That would be considered moderate sedation. And nitrous oxide combined with oral sedatives would be considered moderate sedation. So maybe that patient has some anti-anxiety medication along with the nitrous oxide chairside. That would be considered moderate sedation. It's a drug-induced depression of consciousness, but still, the patient can still respond to verbal commands. And when you think of deep sedation, this would be like if you're having your wisdom teeth extracted and you just have no concept of time or how long that you were under. So deep sedation would be a drug-induced depression of the consciousness during where the patient is not aware. They can't correspond with you. They will respond to repeated stimulation, especially pain, but they're not involved in the conversation. They're not involved in what's going on as far as like having them turn towards you, having them bite down, all of those types of things. So those are kind of the different levels. So when we think of nitrous and you think of inhalation, you have to know what the environment or room air is. So the room air, the air that you're breathing in the room, is about 78% nitrogen gas, which is no benefit for respiration. But the second most common gas is oxygen, which humans need for respiration. And then there's like 1% of trace gases in our environmental air. So when we think about nitrous oxide and what we specifically use it for, like who are our ideal patients to administer nitrous oxide to. So maybe it's a really long procedure and we want the patient to remain calm and anxiety free while they're in the chair. And so sometimes longer procedures can be hard for patients. So that's a great indication for using nitrous oxide. Or maybe your patient has a really severe gag reflex. So the nitrous oxide could assist in just kind of calming that gag reflex so that you have an easier time working with the patient and the patient has a better experience. And then those high anxiety patients or patients who have like a lot of dental phobias, nitrous oxide is a perfect corresponding usage type option for those types of patients. And then really it's just one of the things that you have in your toolbox as a dental hygienist for pain management. And it works really well coupled with local anesthesia. So if you have someone who maybe it's a long appointment, they're a little bit anxious, you're going to give them local. Maybe they're nervous about the local itself. So you can give them some nitrous, kind of calm them down a little bit, and then give them the local. It's a nice pairing for the two to go together. It's important for you to know some of the relative contraindications for using nitrous oxide. So now we've covered, the common uses and indications for use for nitrous, but what are some of the contraindications or relative contraindications for use? So remember, you have absolute contraindications and relative contraindications. So an absolute contraindication would be something where, hands down, absolutely, you cannot use nitrous with that type of patient. So those would be considered true contraindications. But then there's some relative contraindications, which means that you have to proceed with caution, right? Things like COPD. A patient who has any kind of respiratory or breathing issue, think about what nitrous does. It works in our airways, so you have to think about that. Cystic fibrosis. Someone with claustrophobia, you're going to put a mask over their nose. They're going to feel confined and restricted. And then there's always pregnancy on the list. So those are the type of that's on every list for relative contraindications. But then there's some other kind of side note ones, things like upper respiratory disease, recent eye or ear surgery, drug and alcohol use, because this is a suppressant. So those are some of the things you want to think about when you think about the contraindications for use. Now, there are some health professionals who think that nitrous oxide may be the only sedative that you could use during pregnancy. And then others believe that you shouldn't use it at all. Regardless, though, we know that the best thing to do is avoid usage in the first trimester. There's just no drugs that are recommended for usage or safe usage during the first trimester. And honestly, I always err on the side of caution. It's best to avoid nitrous oxide sedation altogether throughout the entire pregnancy. So those are some of the big things. And when I talked about COPD, so chronic obstructive pulmonary disease, think about patients with these conditions using less oxygen naturally as part of their condition. So giving a patient like that more than the normal amount of oxygen could actually cause the body to think it doesn't need to breathe. That would actually cause a crisis or difficulty breathing or no breathing at all, which is not good. So something that you want to avoid. And when you think about patients with upper respiratory disease or patients with a cold or flu, they can't really breathe well through their nasal passages. So that would be a relative contraindication, or someone that has a sinus infection or a deviated septum. These are all things that you just want to have on your radar to think about. And then just a kind of side note is make sure that your patient understands consent. So if your patient is not able to give verbal consent for whatever reason, maybe there's a language barrier, maybe there's a health literacy issue, make sure that you have a protocol to discuss the situation with either a caregiver or a translation person so that you make sure that you have informed consent to use nitrous with your patient. And honestly, as a dental hygienist, you should always be careful with anyone who has a riboflavin deficiency or psychosis. Although, many psychiatric medications do not have contraindicated reactions, the issues may manifest in other ways. So these patients are very unpredictable. So I would call that a relative contraindication to use. Think about the advantages of using nitrous oxide. It works really well and is most commonly administered with local anesthesia. It's very cost effective for the patient relative to other opportunities or other sedatives. And what's really awesome is how quickly you can use it. And then it doesn't require someone to have someone drive them home or take them. Sometimes it can turn into a real nuisance to have bring somebody with you and then have to have them drive you home. So it makes nitrous kind of a great opportunity to have as a option for your patient. So the other thing I just want to talk about is the difference between signs and symptoms. So when we're talking about using nitrous with our patient, you want to understand the difference between those. So signs of nitrous oxide sedation are those responses that you as the clinician will objectively observe in a patient that are due to action or lack of action. And then symptoms are something that is experienced and reported by the patient to the dental professional, and that can be a subjective finding. So some examples of signs of nitrous oxide. So awake patient, lessened pain reaction, normal eye reaction and pupil size, right? Minimal movements of their limbs, perspiration, things like that. Those are considered signs. So a symptom would be something like tingling or numbness, warmth, drowsiness, lightweight sensation, or heavy feeling of extremities, mental or physical relaxation. Those would be symptoms from the usage of the nitrous. There is a thing called a Verrill sign, which is kind of like the droopy eyelids, a slight smile, but the pupils will remain normal. And you will see this on your patient when you are administering nitrous oxide. The other thing that I always notice in a room where there's a patient with nitrous is their feet. The feet tend to, instead of their feet being parallel and kind of upright, they kind of slant outward and the toes kind of hang down towards the floor. I always notice that the feet separate and fall kind of to the side. And that's something that you can just have in your peripheral when you are monitoring your patient with nitrous oxide. Children get a little silly, but it's important that they breathe through their nose to kind of keep them at the right level so that they have a positive experience during their time. The other thing I just wanted to cover was the equipment. So you have a nasal mask, you have a reservoir bag, you have a pressure gauge, and then you have a continuous flow gas machine with cylinders, and then there's flow meters on those gas machines. Nitrous is blue, oxygen is green. So the equipment is cylinders, which are these steel containers that are stored and dispensed. So they're color coded, and then the way that the nozzles all connect also has like a built-in protective mechanism. So the blue cylinders are nitrous. They're 95% liquid and 5% actual gas. The green are oxygen, and those are gas only. So they should always be returned to the vendor for refilling. And there's usually a person in the office, like we have a faculty who specifically takes care of and manages all of our cylinders. They should be stored upright, away from heat, away from open flames, away from lubricants, and chained to the wall because they have a potential to combust. You don't want them to tip over. And they should be tested every 5 years by the manufacturer to make sure that their integrity is intact. So there's a regulator that is attached to the tanks and these pressure reducing valves. So these regulators are like a funnel for the gas coming through the tank into the lines. And they reduce the pressure from the tanks to the flow meter so that it can easily be managed. And then there's this reservoir bag. So a deflated reservoir bag usually indicates a leak around the mask or a deficient minute volume. And then a partially inflated reservoir bag usually indicates that there's adequate seal and minute volume. That's actually what you're looking for. And then a distended reservoir bag indicates either an overly large minute volume or occluded breathing tube. So it's important to keep an eye on the reservoir bag. So what does it mean if it's an underfilled or flat bag? It means that your gas flow, your fresh gas flow, is too low relative to the patient's demand, or the gas is being lost. So some of the common causes of this is low total flow, poor hood seal or mouth breathing, excessive suction, some kind of leaks, or that the patient is breathing deeply or heavily enough to warrant an increase in the flow rate. So these are some of the things that you're going to be observing and monitoring while you're watching your patient. And then what do you do if it's an underfilled bag? You check the basics. You check the tubing connected, make sure there's no kinks, make sure the hood is seated, encourage the patient to breathe through their nose, increase the total flow in small steps. Start by raising the oxygen flow from 0.5 to 1 liter per minute. Tame the scavenger down, reduce that excessive vacuum. And then if the saturation drops or if the patient looks distressed, you just switch to 100% oxygen and then reassess. The goal is smooth in and out movement. The bag should be about 1/3 to 2/3 full throughout the whole process. So maintain your titrated nitrogen while watching the pulse oximetry and the responsiveness of your patient the whole entire time. If you have an overfilled or tight bag, it means that the fresh gas flow is too high for the patient or the exhaled gas isn't being removed. So you have poor scavenging. So what do? We ensure the patient is using the system, encourage nasal breathing, reseat the hood, lower the total flow in small steps until the bag billows normally. Confirm scavenging is on and adequate. Check for blocked ports or kinked hoses. And if the bag stays tense or the patient's effort is absent, stop the nitrous, give 100% oxygen, and evaluate the airway and the ventilation. These are some of the things that just kind of become automatic as you're doing this. Now, the delivery system really just refers to how the gas is provided to the patient. A nasal hood is the most common delivery style for dental office settings. There are some cannula systems, and they've been introduced with minimal tubing and smaller profiles in order to eliminate the dead space and increase the comfort and make easier access for the dental provider to deliver patient care. So there's no reservoir bag with a cannula system, so it's a little bit different. And then the other thing I just want to go over is some of the safety measures. So the safety measures are built in to really kind of keeping safety at the forefront. And it starts with simple things like having a color-coded tank, right? So quick coupling, tubings, outlets, flow meters, and pressure gauges are all color-coded according to the gas that they contain and monitor. So green for oxygen, blue for nitrogen. And then another safety measure would be the scavenger vacuum system. That's part of the equipment designed to capture and safely remove the excess or the exhaled nitrous from the operatory air so that the providers, right? We don't want the dental team to breathe it in. The use of unscavenged systems isn't permitted. So minimize the patient talking in order to reduce the exposure to trace amounts of nitrous. So as the provider, you want to keep that conversation with the patient while they're on nitrous to a minimum. And then there's a pin index safety system. This is just another safety measure that holds on the holes on the nitrous cylinder does not fit the prongs in the yoke that holds the oxygen cylinder and vice versa, so that you're not able to mix them up or swap them out. And then the diameter index of the threading attachments, so the hose threading attachments, are different sizes on the oxygen and the nitrogen to make it impossible for you to mix up and attach the wrong tubing to the wrong gas inlet. So that's another safety measure. An alarm system. Many gas machines have an alarm that goes off when the oxygen runs out. So some machines turn off automatically when the oxygen is depleted, and some have an alarm system. And then there's an automatic maintenance of minimal oxygen levels. So the flow meter cannot go between 2 to 3 liters of oxygen on most gas machines to prevent the possibility of providing 100% nitrous to the patient. So this is just a safety measure that's built in. And then an O2 flush. All machines have an oxygen flush button that, when pushed, fills the reservoir bag with 100% oxygen and enables oxygen to be admitted at a high flow rate to the patient very quickly if it's needed. The cylinders should not be stored near the sources of grease, oil, or lubricants, as I said, because of their potential for combustion. So that is the basics of nitrous oxide sedation, as far as like who are the right patients to use it on, what are the basics of safety, and how is it administered, and where are my contraindications or relative contraindications. There are some specific contraindications that you should be aware of. And honestly, if you're taking local anesthesia and then you're following that up with nitrous, there's a lot of similarities between the two. Nitrous has some real specifics though. So hopefully this was a helpful introduction for you, and there'll probably be more nitrous episode to cover some of the administration piece. I hope you guys are having a great week. I'll talk to you soon. Bye-bye. Be sure to subscribe to this podcast so that whenever a new episode launches, you will get a notification so that you can take little steps towards learning all that you need to know for dental hygiene school. Take care, everyone.